I'm Raajen Patel. I'm the EVP of Innovation and Client Engagement with Sickbay. There are known shortages in the healthcare field, nursing especially, and they don't look to be improving for whatever, multitude of reasons. So we are going to need to make sure that the decision-making support tools that these experts are getting are reliable, because they're just going to get information thrown at them. That information needs to be reliable, and the data that feeds those informational tools will have to be robust. Sickbay takes all that physiologic data, all the rich time series data. It's not the only type of data, but it is a major data modality that it's basically lost and is otherwise only available in this patchwork. It delivers this data to clinicians, to researchers in ways that they find incredibly useful. And it's one place to see all of this data, time aligned, but also one place from which other systems can tie in to see all this data too. The two sort of metrics that I want to improve for clinicians are time to recognition and time to action, because seconds matter in these fields. And so if you don't notice something's going on with your patient in time, there's a cascade of events that might end up with a lot of extra effort and possibly a bad end. And if something is being recognized, but that recognition is not being delivered to a clinician in a way that's actionable, same kind of thing. These delays in care can be really detrimental. And so if you're looking at this patchwork of information and you're trying to hunt things down, that's going to take time and you're going to miss something. And that's not a personal failing. That's just how humans are, right? If you instead have all the information in one spot where you are, you're much more likely to recognize when something's happening and then to be able to act on it. And that delta in time, that improvement in change in time, will help save lives. We have examples of a pediatric clinician who is an expert in a particular set of deteriorations. They've studied a particular set of patients, and they know when that set of patients is okay or when they might be deteriorating. But that clinician's not on the floor all the time. And so what they can do with Sickbay is they can be home, they can dial up some patients. If there's folks on the floor, they're not sure, what they're seeing, if they need a little bit of help, they can call that person up, they can dial it up in Sickbay in a secure manner. They can get that immediate understanding of what might be happening. This folds into what we're seeing right now with a lot of regional and rural hospitals that don't necessarily have the consults or the specialists for, more broader conditions, right? So we've got maybe a so-called mothership hospital, and there's some regional hospitals, and they call in, hey, we have this person in an ICU bed. Should they come in to the big hospital and get a little bit more care? Or are they okay where they are? Can you support us where we are geographically? Sickbay, by connecting these patients with specialists across geographies, can help answer that question. Again, they can dial up that patient, they can take a look, they can make that recommendation. We also know, and this happened during COVID, that a lot of clinicians decided that maybe it was time to retire for a lot of really, honestly, a lot of safety reasons, right? Especially if you're a little bit older. But that's a lot of institutional knowledge that could be lost. Instead, if they could watch over patients, if a senior nurse can watch over more junior nurses in a command center kind of environment, or from their house or in a secure area, then they can provide that feeling of safety for themselves while being able to train the next generation of nurses on watching for patients and taking care of them. These kinds of ideas, making sure that you've got, there's a fourth example if you're willing to humor me, which is we've seen examples, especially with broad virtual care, of helping solve for ED boarding. So this is when a patient comes into the emergency department and the question needs to be asked: should they go to an ICU bed? Should they go to a step-down? Should they be discharged? This is a tricky question from the ED, and it requires a lot of coordination across teams, because maybe there's a free bed, maybe there isn't, maybe this patient doesn't actually need to go to the ICU and there's a patient more in need. But it's a tricky question to answer with Sickbay, you can get everybody looking at that patient from wherever they are to help that broader care team across units make that determination and decide, yeah, this person really needs this bed, or actually this bed could be freed up for somebody else. And this in aggregate promotes better healthcare across your population with less effort across your care teams.